Chapter 4, Hillary Care. As Bill Clinton ran for president in 1992, he campaigned heavily on providing a universal health care program for all Americans. On January 25, 1993, just 5 days after being sworn into the office of the presidency, he made an announcement on his development of the task force on national health care reform.
Today I am announcing the formation of the President's Task Force on National Health Reform. Although the issue is complex, the task is simple. Build on the work of the campaign and the transition. Listen to all parties and prepare health care reform legislation to be submitted to Congress within 100 days of our taking office. This task force will be chaired by the First Lady, Hillary Rodham Clinton.
So with Hillary taking the lead, the health care initiative was slated to be the cornerstone of the administration's first-term agenda. The planning immediately got underway, and almost immediately, so did the rumors, speculations, and leaks. 8 months later, the moment everyone was anxiously awaiting for arrived. On September 22, 1993, President Clinton addressed Congress and unveiled the Clinton Health Plan. And the next day, both the President and First Lady held a bipartisan pep rally on health care at the White House.
We have to do it right, and we have to do it right now.
It is an American problem that we are going to solve before the Congress goes home next year.
So the plan that would contemptuously be referred to as quote-unquote Hillary Care went as followed. All Americans would be guaranteed health care coverage. The plan would be implemented through a quote managed competition system based on consumer groups. A guaranteed benefit package would allow patients to receive a range of medical coverage offered through a local health alliance. Employers would be mandated to pay 80% of their workers' health care premiums. All Americans would receive a National Health Security Card. The National Health Board would monitor and enforce the standard of health care, budget issues, and pharmaceutical pricing. The program would be funded with savings from Medicare and Medicaid with the increase in tobacco taxes. Medicaid funds previously spent by the state programs would be allocated instead to regional alliances to pay for private coverage. Medicare would still be an option. All health plans would utilize a single standard claim form by January 1st, 1995. All states would be required to establish regional alliances by January 1, 1997. So now, is your head spinning yet? Well, that's exactly what happened as the proposal, topping 1,000 pages, was handed over to the democratically controlled Congress. In the days immediately following its release, Hillary would spend most of her time in front of Congress answering questions from one group to the next. All these groups trying to grasp a more comprehensive understanding of a plan that with each day seemed more complex and more expensive. Even the American people who supported the idea at the ballot box in 1992 began to turn their backs. And meanwhile, conservatives joined forces with insurance companies and paint a picture for the American people of a plan that didn't offer enough choices for the patient and in return would be much too costly. An effort by the Health Insurance Association of America included an ad called Harry and Louise, which depicted a middle-class couple frantically discussing the nature of this plan.
The government picks health plans, then we have to pick a plan from their list. That's the choice we get.
But what if we don't like their choices?
The ad started a wave of fear throughout households across the country and sent ripples through Congress as vulnerable Democrats on the Hill began campaigning for midterm elections. The plan that once seemed likely to pass through Congress came to a screeching halt on September the 26th, 1994, almost a year to date after Clinton announced his plan. Senate Majority Leader George Mitchell, a Democrat from Maine, announced the plan was dead. White House advisor George Stephanopoulos summed it all up by saying the administration, quote, bit off more than we could chew, and that having Hillary head the reform was, quote, a mistake. Bob Woodward wrote about the initiative and Hillary's leadership, saying, quote, she was unsure of her role. As the family's lawyer and investor, she screwed up Whitewater, and then in 1994, she had lost what was supposed to be the crown jewel of her husband's presidency, health care reform. And that was just the beginning. Joseph Califano, former assistant to President Lyndon Baines Johnson, said, quote, President Clinton's reform plan, or anything else like it, was basically stillborn because it was so overloaded with bureaucracy that it never stood a chance. Senate Minority Leader Robert Dole had this to say, quote, For all the right reasons, health care reform did not happen this year. The American people said, slow down. 15 years later, here come the Clintons again. And at the top of Hillary's domestic agenda, universal health care. The other Democrats vying for the presidency are falling all over themselves to beat Hillary to the punch. But perhaps they should all step back, slow down, and maybe remember the lessons of Hillary Care. But in the meantime, we have to wonder, with one failed attempt already in her pocket, what does Hillary have in store for us this time around? That's why this is another Clinton chapter that is anything but